The Leeds data model is a commonly pseudonymised linked data set covering health and social care activity in the city of Leeds. We've got loads of different types of data in there, including hospital attendances, admission spells, which people are receiving adult social care funded packages of care, community health activity, primary care activity, so activity recorded by your GP. And we've also got data which is derived from some of that, so things like risk ratings for people, so how frail they are at a particular time. In addition to that, we've also got some geographical data, so things like how deprived an area is and things like that. And we use this data set to understand the city of Leeds, the health and care economy and the people who live in the city, and actually how many services they're using, which services they're using, how expensive they are, and how much need there is in the city. We can't identify an individual in any one data set or any combination of data sets, but individuals within those data sets do have the same reference number. So we won't be able to find particular individuals, but what we do know is that if we find a person with a reference number, we will be able to identify the services they access across the system. And that means that we're able to, when we have an intervention like this full service, start to understand how the people who are going through this service are interacting with the health and care system in the city and what the data tells us about them, which means that we can then chart and measure the impact of the intervention over a long term. So we're carrying out a quantitative evaluation of the foolproof programme, and that quantitative evaluation means that we're actually having a look at the amount of activity in the system for people who are accessing and receiving the service, and comparing that group of people to a very similar control group which we select using a matching algorithm. And then once we've got those two data sets, we will then measure over time and see how often the two groups of people are going into hospital, how expensive the care they receive is, how much community health they're receiving, and we'll actually try and identify differences in the patterns around those two groups of people. So can we say that the intervention group who've actually received services from the foolproof programme are more or less likely to go into hospital? Are they receiving more expensive or less expensive care than the matched cohort of people who are very, very similar? We can't have this standing on its own. We're looking at we're going to introduce a qualitative evaluation aspect as well. We feel that we need to ensure that we understand the stories behind these people as well. So the quantitative evaluation is a part of a much bigger scheme of evaluation work.